Hello, everyone. Gather round. Good morning. I'm Cecchine-Williams. I'm the Deputy Director of the Denver Department of Public Health and Environment. Thank you so much for joining us today on a very, very important occasion for the City of Denver. Today you'll learn about an effort that's been underway for over a year, an effort that involved some of the city's foremost experts in behavioral health, an effort that involved collaboration, innovation, cooperation, and plenty of good old-fashioned hard work. And now, to tell you about the result of this important work, I'd like to introduce Denver Mayor Michael B. Hancock.
Thank you, Ann. Thank you all. Thank you, Ann, for being here. I want to acknowledge, first to start with Bob McDonald, the Executive Director of Denver Department of Public Health and Environment. We're going to hear from him in just a moment. But I also want to acknowledge Robin Francis. Bob was probably going to do this, but she is the artist that designed the artwork for this great band. So, Robin, you're in the room. You're in the place somewhere. Thank you, Robin, for being here. Give Robin a round of applause. We were just standing here admiring it, and they pointed you out, so thank you for being here. You know, last month I said that our city is stronger when each person can reach their potential, cope with the normal stresses of life, work productively and fruitfully, and contribute to their community. This was in my letter to the community when we launched the Road to Wellness, a strategic framework to improve behavioral health in Denver. And I want to thank not only Bob McDonald, but Robin Wittenstein, the CEO of Denver Health, for co-chairing that effort that resulted in this framework report. Today, I am pleased to share with you a big step toward these efforts. To better serve all our residents, the Denver Department of Public Health and Environment is literally rolling out their first mobile unit, specifically designed to meet people where they are and provide behavioral health services to them immediately. Part of our commitment in the Road to Wellness includes improving outcomes for people challenged by behavioral health disorders, like removing barriers, promoting equity in services, and meeting people where they are. Wellness Winnie may look like a small purple RV on the outside, but it's been transformed into a mobile public health unit that will provide services and support that can and will preserve public health in Denver and save lives. Winnie will regularly visit Denver neighborhoods with an emphasis on underserved areas to provide behavioral health and support services to people living with substance misuse or other mental health conditions. The RV is a safe place to talk with behavioral health staff, including peers or people with lived experience, and to receive services or referrals to resources like primary care, long-term behavioral health treatment, and human services. Today, on the Winnie, people can receive overdose prevention education, naloxone nasal spray, and rescue breathing mask. We'll also be offering survival basics like socks, sunscreen, toiletries, lip balm, deodorant, water bottles, hand and toe warmers, hats, gloves, and space blankets. The Winnie will partner with other service organizations to provide a variety of supports and other offerings to the community it will serve, including access to food, laundry, showers, and getting IDs. Bottom line, the Winnie is a tool to help everyone to increase connections to care and treatment, reduce the number of fatal and non-fatal overdoses, and reduce the number of new HIV and hepatitis C infections associated with injection drug use. Last year in Denver, the Office of the Medical Examiner estimates that we had 207 deaths due to overdose. That number will be confirmed next month. The work of the Wellness Winnie is meant to address that number. It is also meant to save lives, to prevent harm, to connect people with a healthier way of living and better ways of coping. In the future, DDPHE plans to expand Wellness Winnie services to include immunizations for common conditions like influenza, hepatitis A, and hepatitis B, as well as screening for common health conditions and self-care demonstrations. Mobile services like Wellness Winnie are a proven way to reach people who may not otherwise have access to fixed services. So I am proud that the city has a way to reach those in need who may be in the shadows, hard to reach, for whatever reason, reluctant to engage and to seek services. The Winnie, again, is a warm place to connect, get information, resources, and if requested, an immediate connection to treatment. So, Bob, congratulations to you and everyone at DDPHE for making the Wellness Winnie available to the community. Will y'all join me in giving a warm thank you and welcome to Bob McDonald, the Executive Director, DDPHE, and the inventor, the innovator of Wellness Winnie.
Thank you, Mayor.
You bet, man.
Appreciate it. Thank you, Mayor. And I want to thank all of our staff in the Department of Public Health and Environment. The Mayor gives me a lot of credit for this initiative, but it's actually our staff in DDPHE that pulled this off with their hard work. I also want to thank our partners in fleet management within the Department of Transportation and Infrastructure for making the Wellness Winnie street ready. The Mayor mentioned the artistic design on the van. I want to thank our local artists for working with the community to determine what the van would look like. And when you see it, we know that art and culture increases wellness within our communities, and we wanted a van that people feel comfortable approaching. So I want to thank all of our partners for working with us on this. We started addressing behavioral health back in 2018 more strategically with our substance misuse strategic plan. And at that time, we realized that we have to get out into the community. We know that people who are struggling with behavioral health issues don't often reach out for help because of the stigma that's associated with that. And sometimes there are practical barriers. They don't have the transportation to get where they need to be. They don't know where the services are. They're afraid to reach out. They don't know who to connect with. We are going to reach out and connect with them. The Wellness Winnie will improve access to treatment, as the Mayor mentioned, to our most underserved communities. The Winnie will be staffed by behavioral health counselors and peer support workers who have actually struggled with behavioral health issues themselves. That makes them uniquely qualified to connect with people, to build those bridges, to reach out to people who are currently struggling. And because so, they're uniquely connected and set up for success. In addition to increasing those connections, we'll be working to reduce the harms of drug misuse. We know that people who use IV drugs are at increased risk for hepatitis, HIV, and a wide range of communicable diseases. In fact, right now, our department, the Department of Public Health and Environment, is working hard to control an increase in outbreak of hepatitis A in our community. We're working hard to reduce overdoses. Staff on the Winnie will be providing training to break the transmission of disease spread and to reduce the number of overdoses that we're seeing. Along those lines, our own Denver Chief Medical Examiner, Dr. James Caruso, made it possible. Dr. Caruso, are you in the audience? I believe I saw him. He's back there. Thank you, Dr. Caruso. Our staff will be carrying naloxone with them. Naloxone is a drug that will reverse opioid overdoses. Before that's administered or given to anybody who needs it, we'll be providing training on how to use that. So you may wonder, who can take advantage of the Wellness Winnie? The answer to that is simple. Anyone who needs it. Anyone who needs it. Whether you're housed, whether you're unhoused, whether you are in long-term recovery, or whether you're just beginning to feel the challenges of behavioral health, we are here to help you where you need it, out in the community. You can find out where the van will be, where the Wellness Winnie will be by checking our website. You can call 311. You can contact our department, or you can look at the program card that our department and many partners throughout the city will be handing out to our community. In the lower corner of this program card, you'll see a QR code there. Anyone who's in need of services can take their cell phone, pass it over that QR card, and they will know where we're going to be, where they can connect. It's the mission of the Department of Public Health and Environment to help everyone in Denver's communities to live better, longer lives. Everyone. The Wellness Winnie is going to help us achieve that in an equitable manner by bringing services to everyone where they are. I will tell you, I just found this out this morning. Already, as our staff members were setting up for today's event, we had people who were struggling approach us. Already this morning, we had people approach the van and they've asked for help. We provided them with some services, trying to connect them. That's the ultimate goal here, connect them to long-term health care. With that, I want to thank you all again for being here today. Thank you, Mayor, for your support. And I'd like to invite the mayor to cut the ribbon so we can get to work here.
All right. 1, 2, 3, we go.